Good afternoon, and thanks for joining us for Living Local, your lifestyle show for all things Charleston and beyond. I'm Ashley Meservey.
Medical Monday, sponsored by East Cooper Medical Center.
Joining us today, we have Dr. Christopher Robinson. He is a high-risk pregnancy specialist here at East Cooper Medical Center. Thanks for being with us today.
Thank you.
All right, so we talked earlier about you being from Anderson and everything like that, and just a pleasure to get to know you. Let's just talk about overall, what is maternal fetal medicine? I mean, you specialize in it. What do we need to know about it?
Yeah, certainly. So maternal fetal medicine, oftentimes by the patient, is recognized as a high-risk pregnancy specialist. So in other words, an OBGYN who has gone on to do additional training, specifically in genetics, ultrasound, medical, and surgical conditions of pregnancy. So it's really like a super specialist within the realm of obstetrics. So most of the things that we see obviously deal with pregnancy and sometimes prior to pregnancy and planning that pregnancy.
So you're taking steps before they have the baby, right? Not dealing with the aftermath of after they've had the child?
Actually, both times. That we actually continue
Does it
care,
all. Yeah.
right, all the way from beginning through the end. Sometimes people develop complications at the very end of their pregnancy that extend into that postpartum time period. So sometimes we're also involved in the postpartum time period as well.
Let's talk about tips, as far as setting yourself up for success. I'm sure you have a lot of things that people could do that is more of a proactive approach, right?
Right. I think, there's several things people should think about. First of all is planning. A lot of pregnancies are not planned, so you always have to be planning for possible pregnancy. And one of the simplest things a person can do is evaluate their folic acid intake. Folic acid is very important in preventing spinal defects, brain abnormalities, cleft lip, cleft palate, and some heart defects even in an unborn baby. So it can be very beneficial to start that 6 months prior to becoming pregnant. So just taking a vitamin per day that has folic acid, for instance, can be a very simple intervention.
How would you know if you were low on it or your levels?
It's a great question. So in the 80s, most flour products were supplemented with folic acid for exactly this reason. In other words, we knew that folic acid could prevent up to 70% of congenital birth defects that babies could have at birth. And as a result, we added folic acid to flour, which most people will get adequate folic acid just in their diet. But to be extra safe, we recommend that a person get at least 400 micrograms of folic acid in a supplement daily. So any person who could potentially become pregnant is really the key word. If you could potentially become pregnant, you should be on a multivitamin that has folic acid in it. That's a good way.
You don't just need to wait until the pregnancy's here.
That's
obviously,
right.
It's better to do it than not do it at all, right?
That's right. So many pregnancies, half of pregnancies are unplanned. They happen. And it's great. I mean, that's very exciting. But we want those babies to be as healthy as they possibly can be. And that's a simple way of doing that.
Talk about your role as far as your interaction with an OBGYN and things like that. Is that a crucial relationship?
So, it is. One of the other key things that women can do is seek early prenatal care. You should go to your OBGYN. You probably already have a relationship with a person who's doing your contraceptive, maybe your birth control pills, maybe your IUD, and you're thinking about becoming pregnant. Open that discussion with that person. Have that discussion with them. I'm thinking about having a pregnancy. And then once you're pregnant, come in early. Get that first ultrasound, take a look, evaluate that pregnancy and evaluate what your risks are. So once there's an evaluation of those risks, your OBGYN will make a decision about whether a maternal fetal medicine specialist could assist in improving that pregnancy outcome.
So a large portion of your responsibilities is dealing with pre-existing conditions, diabetes and things like that.
Mm-hmm.
Do you work with those doctors as far as making sure that you get the information and assess it correctly?
We do. So one of the key things we do is diabetics, for instance, we follow sometimes throughout pregnancy. Pregnancy itself changes how their disease process is going. In other words, just carrying a pregnancy increases the need for additional control measures to ensure that baby is healthy in utero. And so oftentimes those patients we may see throughout pregnancy. Say a person has just a simple risk factor like age as a risk. We may only see that person one time during their pregnancy for evaluation. It just depends upon what is specifically going on in that pregnancy.
So I find that a lot of physicians have like a mantra. So you're gonna leave us with this. Do you have something that you're finding that you just keep repeating yourself saying to your patients, or that you wish they would have known?
Yeah, I think the most important thing is ask questions. I think you need to be planned for a very open discussion, open dialogue. Don't be fearful that someone will say, that's just too high risk, or you shouldn't become pregnant. I can't tell you over the years how many people I've heard say, I just shouldn't become pregnant, when pregnancy was really not impossible and even safe for their condition. So if there is that question, ask the question, because there are things we can do to improve their outcome.
So I bet you just wish that people would have asked it, and if you would have seen me sooner, we could have, you know, but we're going to make it work. I bet you make miracles happen all the time. So, all right, thank you so much again for being with us. And for more information, you can head online to eastcoopermedctr.com.